Strong Enough merch is now available. Go to strongenoughpod.com and see all the things that you can get to show your strong enough pride, as well as remind people and yourself that you are strong enough and you are worth it. Welcome to the Strong Enough podcast, where we talk about the challenges and celebrate the triumphs of people just like you. I'm your host, Claudia. Today's guest is going to talk about her work as a pelvic floor physical therapist. She's going to discuss the prevalence of pelvic floor problems and why it's important that we recognize these problems are common but not normal. She's also going to share about her book, The Musculoskeletal Mystery: How to Solve Your Pelvic Floor Symptoms. Please help me welcome Ingrid Harm-Ernandes. Ingrid, good morning. How are you today?
I am doing well. How are you doing?
I am also doing well. It is a lovely Friday when we are recording this. It won't be maybe when people are listening to it, but I'm excited for the weekend. How about you?
Absolutely.
Well, we have been chatting for a few moments and we have already learned so much that we have in common. And I know that that is going to continue through our chat here. I would love it if you would share with the audience a little bit about yourself.
Oh, thank you. First, thank you for having me on. I so appreciate talking about all these topics that a lot of people don't necessarily want to or know, to talk about. So I'm a pelvic physical therapist. I've been a physical therapist for about 39 years and a pelvic PT for about 27. And you see that gap in there is because when I started, there really wasn't such a thing as pelvic PT in the United States. So I had to do my homework and find that in Australia and in Europe, there was much more of pelvic. And at that time, it was called Women's Health PT. It's now a little more encompassing because everybody's got a pelvic floor and a pelvis. So we treat everybody. And that kind of evolved over time. And when I went over to Duke, about a little over 20 years ago, I was with part of a team that we really worked hard on trying to get more of this knowledge and information out. So we developed a residency program, the first one in the country. We had all sorts of projects that we did with our physicians. And then towards the end of my time at Duke, I was fortunate to write a paper with AUGS, which is the American Urogynecological Society, on how to do a comfortable, accurate musculoskeletal pelvic floor exam. That's a mouthful. But my goal was I wanted every single woman to have a comfortable pelvic exam. There's no need for a painful exam. So I actually teach lab courses based on that paper all around the country, and that's been a blast, really meeting all sorts of people and other physical therapists, physicians, PAs, and so forth. And then the very last thing that I would say is a big thing for me is my book. So I wrote the book, The Musculoskeletal Mystery: How to Solve Your Pelvic Floor Symptoms. And that was not quite 2 years ago that came out. And that has been an amazing, amazing journey of really teaching people about their pelvic floor, about their pelvis, how it integrates, why the musculoskeletal system is a mystery, and then how they can get help or help themselves. So it's a really comprehensive book that covers all of that. And I have been so fortunate to meet so many wonderful people to talk about these topics that people just are, yeah, they're not so sure they do want to talk about. And the light bulbs go off, right? And they understand that they can get help.
I love this and I can relate to it because I do experience severe pelvic floor dysfunction. So I really resonated or it really resonated with me when you spoke about not a miserable pelvic exam because I'm not familiar with that. I'm also very excited to pick up your book. What I would love to know from you is what led you to decide that that is where you wanted to spend your time and your efforts in working with the pelvic floor and helping people learn that, issues with it are common but not normal.
Yeah, yeah. So it was, I would say, it was almost out of frustration, which is kind of, a funny thing to say, but I had patients who were walking my door And they had problems for 5, 10, and even 30 years, and no one knew to send them. They didn't know what to ask for. No one educated them on their pelvis or their pelvic floor. And the physicians and nurses, PAs didn't know that pelvic PT existed or weren't familiar with what we do. So it's kind of this like this world of we're not sure we want to talk about those things that leads to, on both sides, people not knowing that there's even something that can help them. So I kind of thought, I need to change this. And I love to educate. So although I'm an introvert, I love to get out there and have people, like I said before, have the light bulbs go off. And I thought, how am I going to do this? And so Heather Florio is the CEO of Desert Harvest, and we know each other. And we were sitting one time just talking. She's like, "You need to write a book." I said, "Well, 1,000 people have told me that, but I don't even know where to start." She said, "I can help you get the start." So she kind of gave me the kick in the pants, is what I'll say, is to get that start. And I wrote it and just sat down and it all flowed out. And in 6 months, I had that whole thing like out on paper, so to speak. And we worked on it with lovely illustrations. And there's lots of like pictures and just charts and stuff that help people, whether you're a layperson or you're a professional. It doesn't matter. I wrote it so everybody could understand it. So what I'm trying to do is get everybody on the same page, literally and figuratively, so everybody can understand, oh, this is me, or this is a loved one, and I can help someone else, or I can help myself find my way to get better with these things. And I find like if I can do that, and now I go out and I talk, I do educational things, I do conferences. Yesterday I was at a women's in networking little meeting, and they said, "Here, you've got 1 minute to tell us all about it." I'm like, how do I talk about this in 1 minute? But they were fascinated even in that 1 minute, and they came up afterwards and started talking to me about it. And that's just been, I guess I'm so glad that my goal of educating everybody and making those connections is working one bit at a time. And, even if 5 people listening say, "Wow, that's me," "Wow," or 5 more people say, "That's my husband, that's my wife, that's my girlfriend, that's my aunt." It doesn't matter. It's if you can find that help for someone, then I'm thrilled. That was my goal with all of this.
I want to divert for a moment because you mentioned Heather Florio, who I absolutely love. She is a powerhouse of a woman, and I would love to hear from you what it's like now to be surrounded by amazing women like Heather and yourself who are committed to making things better for other people. So what is that like for you to have other women supporting you and in your corner and willing to push you to do things that people really need to see and hear?
Yeah, I think the more you can do that, the better it is. A lot of times, so I mentioned being an introvert before, and I've talked to some people that are like, "You can't be an introvert." I'm like, "Oh, yeah, I am." But most people don't understand introverts can be very social. They can get out there, they can talk. They need recharge time, they need me time and alone time, right? If you want to look at it that way. So in the beginning, as being a bit of an introvert, it was really hard to reach out to people and talk to people. And I have to say, pivotal moment for me, I think, was one of my fellow physicians said to me, "Ingrid, I'm supposed to do this talk on sexual dysfunction." This was over 20 years ago. And she said, I don't think I can do this myself. You need to get up there and talk about pelvic PT. So I'm like, sure, I'll do that. That's fine. And me being organized, a few days before the event, I called or emailed, I don't remember, the event director, and I said, "So can you tell me about how many people are going to be in the audience?" Expecting like 20 or 30. And she said, "Oh, we're well over 300 and it keeps growing. There's going to be standing room only in this ballroom." I was like, "What?" So, I had to get my Superman pose, my diaphragmatic breathing, and all the things that I teach other people, and kind of get up and talk to one person at a time. And the pivotal moment for me was, I can do it. Why am I not reaching out to other people? Why am I not saying things? Why am I not forming a network? And so that gave me kind of that push to start reaching out. And when I reached out, people came back and we formed a bigger and bigger network. That was awesome for my patients because at the end, I had this amazing network of sex therapists and acupuncturists and massage therapists and other physical therapists that you feel like you've got a platform under you that people are encouraging you to stand up and talk about what's important, and you get over yourself, right? You get over whether it's an introvert or you're shy, it doesn't matter. You get over that. And I think that's where the team of amazing women, when you see other people doing it, you kind of say, I think I can do that. And the more you do it, you do it. So I think that's the benefit of having that network. And studies show that having a network like that improves everything, your ability to do things, your I'll call it your mental attitude, like how do you approach things, how do you do things, that all gets influenced. So I encourage everybody, reach out, don't be shy, do it one person at a time, that's okay, and before you know it, you've got your network.
Let's talk a little bit more about networks, but in the medical care sense, because I advocate for people to have a care team anytime that you're dealing with a chronic illness. And really, anybody should have an entire care team. It shouldn't be just one person. So, will you talk a little bit about the importance of making sure that you have the right people on your team and why it's important to have a care team?
Yeah, that's such a perfect comment. The team, right? So actually, in the book, there's an entire section on forming your team, because especially when you talk about pelvic conditions, rarely is it something that, okay, you can just go in, you get some treatments, and you're done. Yes, there are cases like that, absolutely. But when we're talking about things like chronic pelvic pain and interstitial cystitis and other things that involve the pelvis, there's usually other stuff, I'll call it, that's going on because a lot of people have suffered for a long time before they get to the right practitioners, right? So, what I do in the book is I go through all these other practitioners that come together with physical therapy and help a treatment be more successful. And what I mean by more successful is one practitioner might be able to resolve, let's say, 80% of what you're doing, but that 20% is still very bothersome or allows things to creep back, right? So, another practitioner, for me, it might be I can do a lot with someone if they've got pain with sex, right? That's something people don't want to talk about. Pain with sex during menopause, during all these pelvic conditions, they come together and often happen, but the person doesn't come in the door asking about pain with sex. They come in the door asking about incontinence, right? And then I discover this, so we start talking about a team that can look at, do we need other things for tissue health, do we need your physician to do a test, do we need an acupuncturist to calm the system down, do we need a sex therapist to work on relationship issues, do we need psychology, some kind of mental health involved in this to help overcome other issues that maybe are barriers somewhere, right? So that's where the team is, to me, is ultimate. I never thought I could cure someone 100% without looking at possibly having a team member in there. And the patient is the lead to the team. That is so different than a concept you see is where a patient comes in, gets told what to do, here, take a pill, and you're on your way. Instead, the patient's like, well, I have this going on. What do you think? And then the practitioner should be able to come back and say, well, for our team, not just me, but I think maybe this person will help or that person will help. Or, in within your own family, is there a family member that can help you? Is there a clergy person that can help you? Is there someone in a religious capacity that can help you with something that's spiritual? There are so many different avenues that can be taken. And if patients start to be thought of as like a team member, I think medical care can get so much better. Right. And I stand on my soapbox all the time. I've talked about interdisciplinary care since as long as I can remember, before it was a fancy thing to talk about. I thought, why are we not using teams? Why? Why? I don't understand. And it's getting better, but I think we still have a lot of work to do on that.
That was going to be kind of my next question because I feel like we as patients are kind of responsible for putting together our team. I like how you said that I guess we're kind of the coach, as we should be, the coach of our team. But I think we need more help finding our team. So, what resources do you think are helpful in putting together that team?
Yeah, multifaceted. So I'll go back to the book because the book lists out like what each team member is, what their profession is, what their websites are, all that kind of stuff. So, like, if you were not sure, you could crack that open and say, "Well, I need a sex therapist. What does that mean? What do they do? And how do I find them?" Right? That answer is everywhere. Urogynecology. There are so many team members there. That's all listed in the book. For a person, if you have a particular diagnosis and I guess for physical therapy, we are function based. And what I mean by that is you may have the same exact diagnosis as the next person walking in the door, but it doesn't mean your treatments are the same because you're different people. You have different lifestyles. You're at different stages in your life. I'm not going to treat a 25-year-old with two kids the same as an 80-year-old who's retired. It's just that the lifestyles are different. Why would I do things exactly the same? So we want to look at, as far as the patient's concerned, you've got that diagnosis. Usually there are, whether it's an organization or a company that deals with different things, I would, under caution, just have people look at different organizations that deal with that specialty to kind of look at what does it mean. Now, the reason why I say with caution, I have an entire section in the back of the book that is to avoid Dr. Google, because a lot of times what you see on the internet scares the living daylights out of people, into thinking something's deadly or horrible, whatever, when it's not. So I would say if you already have a medical practitioner, usually they have resources out there that say, okay, try this, try this, try this. Use my book to say, okay, this is a reputable resource. Look at this, and this, and put a bunch of different information together and then ask a practitioner, I saw this, and this. What are your thoughts on this? Because then that practitioner can say, whoa, that's not so legitimate. Or, yeah, that's a really good site for this kind of condition. So there are a lot of ways. I wish it was an easy, straightforward answer, but there's as much bad information out there as good information, I hate to say.
Let's talk about Dr. Google because we have all seen those memes, where, oh, I have a headache. I Googled my symptoms. I'm going to die tomorrow. And we laugh about it, but that often is what we find on the internet. So would you say, because of the time period kind of that you worked with or have been working with pelvic health, we went from barely any internet to now everything at your fingertips. So, will you talk a little bit about how patients have changed in that time with not really the ability to gain any information on their own to now having everything good and bad, accurate and inaccurate right at their fingertips?
Yeah. So yeah, when I started, internet really wasn't a thing, and someone had to like go to the library. I had to go to the library to look things up. I'll date myself there, but yeah, so I would say this, that in the beginning, when people didn't have stuff to look up, the blessing was they didn't come with a preconceived notion that could have actually hindered them. They came in, they listened to what you said. Okay, this is good. They could follow it. I still would recommend other team members, even way back then, when I building whatever I had as a network. Fast forward to today, people come in with preconceived notions that can really scare the bejeebers out of them. So they come in very upregulated, very anxious, very, oh my gosh, this is horrible. And I heard all these things, and my neighbor said this. And, they end up being so, the word upregulated that I use is their whole system is ready to go. The anxiety is high. Now you have to bring someone down off of that in order to treat them well. And physical therapists, and especially pelvic PTs, incorporate a lot of this, like whether it's things for diaphragmatic breathing and calming the body and so forth, because we see so much of it. The pandemic, oh my gosh. What changes I saw in my patients during the pandemic was very difficult. It's really difficult being a practitioner on a lot of levels during the pandemic. But a lot of times, like when we were doing telemed, I'd have to say to my patients, okay, so we're for a second, we're going to throw regular PT out the window. We're going to do diaphragmatic breathing. We're going to make sure you go outside, you see greenery, you do things that are with your family members, whoever is healthy, do things that you still see people. And I'd have to start with that. And I said, okay, now we can go back to doing what we do in pelvic PT world. But I had to do it first to get that system down, right? So I think the really, really bad part of today is that there's so much bad information, or there's an overload. Even if it's good information, there's an overload. I tell people, try to do just like, is it research based, but even take that a little bit with a grain of salt, because a lot of research out there is driven by certain um what's the word I'm looking for, whether it's an organization or a company that has an idea in mind what they want the research to look like. So even there we have to be a little bit careful. So I won't say there's an easy answer. I will say it's okay to be on the internet, look a little bit, find some things, shut it down, and then ask a practitioner who is experienced in it, what are their thoughts on it. Don't make decisions, don't get scared about things, because what's on the internet is often sensationalized so that more people read what's out there, right? And it's so hard. I have 4 videos on the pelvic detective on YouTube, and people have watched it and so forth, but it's interesting that sensationalized things by some star gets all these hits when you're trying to put legitimate information out there. And like, people, please, listen to something that's by an expert rather than things that will scare the living daylights out of you.
I had an experience with that because I am one of those people that Googles everything. And I normally do take it with a grain of salt. But a few years ago, I had sinus surgery and they had to put the splints into my nose for a couple weeks. And so I started Googling a couple nights before what it was like when those things came out, because sinus surgery was not pleasant. And immediately I was terrified because every person that I looked at was like, "Oh my gosh, this was the worst thing ever, getting these things taken out. I thought I was gonna die. It was horrible. The pain was worse than the surgery." And so I'm freaking out now and get into the doctor's office and it was nothing. Literally just they pulled them out and I was like, "Wh what was everybody complaining about?" So I completely have experienced what you're talking about in l filtering through the information, and somehow the sensationalized information finds its way to the top of the pile. So, what do you think we can do to try to get the good information hitting higher up? Is there anything we can do, or do we just have to cross our fingers and hope?
I think the more people try to look for the kind of the reputable sites, whether it's a major, institution, it could be Duke, it could be, the Mayo Clinic, it could be other organizations that are well known, their reputations based on what's out there. They're not going to put sensationalized information out there. So really try to start with major organizations like that. And there's plenty out there that lists out, this is what's going on. There's research backed, these are the prevalence of this condition, this is what may happen. It's not like, oh my gosh, if you have this, they may talk that I'll give you an example. So let's say 5% of the population that has this condition has something, a more severe or significant reaction, or has symptoms that are more significant. The website will list out, well, 95% this and this, and 5% this, which you're like, okay. The sensationalists will be like, everybody's got this problem and you need to take this, herb and that. If you start to see a site that's got that, shut it down. Don't continue to look at it, because the more we look at those sites, the more they get to the top. That's how these these systems that they have on social media is, it encourages hits on something, and before you know it, that gets a snowball where something that's got good information does not, because the algorithm just doesn't work well, right? So people have to realize there are algorithms that get us to do things, and social media is so well trained in these, that makes us want to funnel down a path. And it's a big issue overall in life right now, as we funnel down paths instead of meeting people, talking to people. It doesn't matter if you agree with what I say or not. Let's all be able to talk with each other. We're all human beings, right? That's the bottom line. We're all human beings. It doesn't matter if we agree on everything or not. So these algorithms, just like everyday life in medical, that's what they do. They put us down a path. So ask people to try to find the most reputable, large organizational websites that will give you more reliable information, and try not to do the sensationalized. I won't mention names, but like I said, there are stars out there that put information. I'm like, who made you the expert? You know, I don't understand this. You can't counsel people on stuff. You don't have the knowledge base yet. People watch them and follow them every day. So try to stick with reputable sources is the bottom line.
So, one of the things that has been on my mind a lot lately, because of an organization that I'm on the board of, is companies who are trying to sell the cure for a lot of different circumstances. And it's very frustrating because you flip through ads or you see them online of, you're cured in 1 2 3, and it's really bugging me lately. I love somebody like Heather, who is doing research, who is doing clinical studies, who isn't, saying buy my product and you're going to be cured. She talks about the benefits. How frustrating is it for you as an expert to see some of these companies who are trying to sell desperate patients a quick fix?
Yeah, it's horrible. It's horrible because they've been sold a bill of goods. They've been told you're going to feel great, and they start taking things, and then there's, of course, oh, you have to do it for months and months and months, and there's no benefit. So a lot of the supplements out there are not regulated at all. There is research that shows that there's a benefit of, I'll give you, vitamin D has an immune system benefit, and that has been researched. So a lot of times I'd have to talk to my patients about what has actually been reviewed, researched, and said, okay, yeah, there is some benefit to this. It's still not a cure-all. There's nothing out there that you could say is a cure-all. Can it benefit some people? Sure, probably it could. Others, not so much, but to the tune of thousands and thousands of dollars, right? And I think that's what bothers me so much is, so much gets out there that we don't know what's really in that bottle. We really don't, right? Even the supplements, you don't honestly know, okay, is this 100% what's supposed to be in there? So that's my beef with the whole supplement industry, is it's not regulated, and they can get out there in front of someone just as much as someone who really has experience and knows, like, the overview of everything. I still reach out to, the doctors I've worked with occasionally and say, so I've heard about this touted for X, Y, and Z. What are your thoughts on that? And they can easily say, not only this is what we see in research, but they can say, we've had X number of patients that utilize that and they do get benefit from it. And it may be 80% of them that get benefit from it. But a medical practitioner will say that is like, okay, well, 50% of people get better by doing this, and usually they're in this category. So then the patient knows, well, I'm in that category. If I'm willing to try it, I could. If I'm not in that category, why am I wasting my money, right? So again, the practitioner can kind of weave you through that a little bit, but it's an advertising world. I don't think we can change that much, except to really have people be on alert that these supplements and so forth are not regulated. There is nothing that says it is a valuable or viable instrument to help you, right? And if people understand that a little bit better, then they'll be a little bit cautious to just jump in and try something new. And yeah, Heather's awesome in that she really is doing research to back up what her supplements do. And it's a product that I have absolutely recommended for my patients over and over again, because and I could see it. Like the first time I recommended it, and someone came back and like, I wish I had known about this years ago. And the more I recommended it, I had everybody coming back to me say, this is an awesome product. So I had my own little research going on that said, this was beneficial. This really helped. I got my docs who worked with me to start recommending it. And they're like, this is beneficial. So it snowballed that way because it was a product that honestly 100% helped people with whatever the issue was that was going on.
I want to go back to your book for a moment because, I can't imagine what it's like for you to see change in people because of the words that you've written. So, will you talk a little bit about some of the things that you've heard from patients or supporters of patients who've had the opportunity to read your book and the benefits that they have experienced out of learning about their pelvic floor and what may or may not be going on?
Yeah, it's been absolutely amazing in that I'll give you an example. So my local farmer, we've gotten to know him really, really well, and he occasionally has instead of just his farm stand, he'll invite 6 or 7 other vendors, and usually they're a little bit more earthy related, I'll call it. And he said to me one day, "Why don't you just bring your book down and do a book signing down here?" And I'm like, "Oh, what the heck?" What can it hurt? So I went down and I talked to so many people and I sold books and signed books, and we just had a great time talking. And I don't know, 2 or 3 weeks later, I was at the farm stand getting my produce, and a woman walked up behind. She goes, I got your book a couple weeks ago when you were here. I can't believe the difference it's already made. I've tried the exercises, I've tried the self care, I've talked to my neighbor about it, I've helped other people about it." She was just so excited. And this was so, random out of the blue. If I do a conference, I might not see people. The other comments I've had is, I'm trying to remember. Oh, I went to visit a colleague, and there was a brand new therapist there, and she had the book in front of her, and I have not met this therapist. And I introduced myself. She goes, "Oh, this is your book." Brought this in and said, "I need to look at this book. This is an amazing book." Like, it was totally random again that these connections were made. And I've had other people just come up to me and say that changed my life. It changed how I thought about my pelvic floor. It changed how I thought these conditions. I could not do anything about it. I would have to take a pill. I'd have to have surgery or just live with it, honey, which is a frustrating thing that I heard for years when I was doing the therapy. That people are now saying, I can help myself. I don't have to live with this. I'm not alone. I'm not the only one suffering with this. I can talk about it, and I can talk about it to other people. In the United States, about a third of women have some kind of pelvic floor disorder. That's crazy, right? We don't talk about it. It's a huge percentage of the population. We don't talk about it. Men also have issues. The percentage is a little bit lower. That's the only difference. But we've got to stop being shy about talking about it. And so the beauty of the book is people actually just come up to me and start talking to me about it. I'm like, I am so thrilled that you're willing to talk about something that maybe a couple of weeks ago it's like, I can't talk about this. I can't. This is too embarrassing. Now it's like, guess what? So I've loved that aspect of it.
Are there more books in the future?
I am thinking about it. There are, so I've had some circumstances myself that I've been through that are leading me to maybe emphasizing certain things that are out there that I didn't even have as in depth of knowledge about until going through it myself. And I think that's what happens with everybody, right? You suddenly gain an insight you never had before. And I do have a section on pregnancy and fourth trimester, not postpartum. Postpartum thinks 6 weeks after giving birth, you're good to go. Go out there and do whatever you're doing before. Mm, fourth trimester can be a year or more after, and it's really what is affecting that person at that point in their life, and how we need to address it, and how fourth trimester has a lot of similarities to menopause. And these are things that we just don't talk about. Why do we not talk about it? It's because it's, either taboo or just live with it. Right. So those are the things that maybe I would like to focus on, things that I think will be important to bring more to light and have people feel comfortable, talking about it. And I've been on a fair number of menopause podcasts now, which has been a blast, like to really see, wow, why were we just living with all this stuff before? And why do we not talk about it? Why are we embarrassed about talking about it? And changing that concept. So I think if I had to do something, it would be in those categories that I probably would think about doing, either an addition or a new, or we'll see.
I love it. Good teaser. So, we are going to take a quick turn here. I'm going to ask you a couple questions. I first want to start with the art behind you. And for those who can't see it, it is a pelvis with a sunflower in it. Now, my first thing is I have a friend who's a physical therapist. She also has artwork of different bone structures with flowers coming out. So I want to know if this is like a secret physical therapist site where you guys are getting your art. What I really want to know, though, is what that represents to you.
So the pelvis with the sunflower in it is mine. I painted that, and I don't know. It was funny. It was a time period where I was trying to figure out how do I merge a lot of my loves together, and I love to garden. Flowers, vegetable, you name it, I grow it. I love to do it, and it is kind of a symbol of growth and change, and always something's always different on the horizon for me. My love of gardening, my love of being a pelvic PT, and all of that thrown together, just painting that happens to be watercolor. Just and watercolor flows. Watercolor kind of rules you. You don't rule it. You have to learn to change with it, right? So it means a lot of different things to me. I'm glad you asked that, because I don't know if I've ever thought of putting that all together until you just asked me that. But it puts all my loves together in one place. And I have a dear, dear physical therapy friend who wanted to have something on her walls. And so I did one with orchids. It's similar to this, but has orchids flowing through it. And she said she continually gets comments on the pelvis and orchids. And it's something that I would love to continue to do. So it's an outlet for me where that's my world, and everything else goes away when I do that. So I think physical therapists love the idea in general. That's me, but love the idea of merging these things together, growth and change, and that things are alive, and it's a good thing, not a negative thing. Our pelvis is a positive thing, not a negative thing. And even if you've been through negative past history of things that are not good, that there's a time in life where things can bloom and things can change and things can get better. We just have to find the right team, going back to what we were saying before, right? So I think hopefully we can help people understand that teamwork, whether it's personal or professional, and doing things like this is what helps everybody get through parts of their life and grow, right?
It sounds like also you may have another career option should you decide not to write another book or whatever. You can paint. I want to talk quickly about another form of art, and that is tattoos. I know that you don't have any tattoos, but I'm going to put you on the spot here for a second. I would love to know, and we may have a hint here already through our conversation, if you were going to get a tattoo, what would you get and where would you put it?
Oh, great question. Because I was thinking, hmm, there are a couple ideas as kind of a little crazy and wild. So my company is called Chipmunk Enterprises, and I would consider putting a tiny chipmunk on my butt. Kind of a hidden gem, if you want to look at it that way, in honor of my, what I like to do, and merge together. Again, being on the pelvis, all thinking of the pelvis. I guess that's why I want to put it on my butt. um, is to do something that integrates hummingbirds and flowers. And that's kind of a family, it would mean something family wise to me. So I think if I ever were to have a tattoo, it's thinking of family unity and that kind of thing. Or, like I said, a little chipmunk that's hiding out back there.
I love this. So I'm going to try to make this happen for the audience. I'm going to work on this with Ingrid. We're going to try to make this chipmunk happen. Ingrid, where can people find you? So if they want to grab your book, if they want to maybe talk to you a little bit and learn more about our pelvic floors and what's normal and what's not normal, or if they want to accompany you to the chipmunk tattoo, where can they find you?
So the book can be found on Amazon and Desert Harvest. So we talked a little bit about Desert Harvest. Once you go there, you can see the amazing kind of things that they sell on Desert Harvest. Amazon is, some people just love their Amazon, so we try to make it findable for people there too. For me, I mentioned the Pelvic Detective, so there are 4 videos up right now, just going through the basics of pelvic floor care, what it is, what it means, how to do a pelvic floor contraction, not a Kegel. All of that's on YouTube. And then I have an Instagram account, and then Facebook and LinkedIn. So LinkedIn's been great. It's a very professional site for me. I've made amazing contacts on LinkedIn. So usually what I'll do is I don't post a ton, so I don't flood anybody's inboxes, so to speak, with that. But occasionally it's something that is relevant to that month. So next month is interstitial cystitis. I will post something that is relevant, that has information that's important to know for anybody who has interstitial cystitis. So that would be one thing. And then sometimes I do life related things. So it's just very simplistic posts that someone can get a lot of great, reliable information that we were talking about before. So that's basically what I do on social media.
Excellent. Excuse me. I'm going to take one moment to plug something for interstitial cystitis, or IC, only because you brought it up. Our wonderful governor here in Colorado, Jared Polis, has actually declared September 2023 Interstitial Cystitis Awareness Month. So we just got that done. I just got the proclamation. Very exciting. So hopefully we will see some other states follow suit. Ingrid, you have been absolutely amazing. Thank you so much for taking the time today to share your experiences, to talk about the pelvic floor, and to remind people that we don't need to be shy. We need to talk about these things, get them out in the open so that we can all get help. So thank you.
Oh, thank you so much. If we can just get people to understand that these conditions are common, not normal, we want to normalize the discussion, not the conditions, right? That's what I tell everybody. If we can just get it so everybody is comfortable talking about it, so many more people will get help for it.
Thank you.
Thank you.
If you enjoyed today's episode, don't forget to subscribe and follow us on social media so you'll never miss what's going on. Remember, until next week, you are strong enough, you are worth it. Thank you for listening to the Strong Enough podcast. You can find us on your favorite podcast platform by searching Strong Enough. And on YouTube, we're on the Spear Talk channel. Don't forget to follow us on Instagram and Facebook at Strong Enough Pod. If you have suggestions for an upcoming episode or a future guest, please reach out at strongenoughpod@gmail.com. Remember, you are worth it.